Hey everyone, it's Tonya, and welcome back to Nurses Speak. I just have a quick video for you today. Happy New Year, by the way. I know it's been a few days, maybe weeks since I've actually posted a video, but I'm back today and hopefully we'll be on a regular schedule. So once again, this is Nurses Speak, your channel for conversations with nurses and explicitly for nurses of color, but welcome to all nurses who just want to have a safe space to speak. So remember to like, subscribe, and share, and stay in the know. Now, I just read an article today, and that's why I just made this impromptu video, because I just read today on Medscape. I don't know if any of you subscribe to medscape.com, but I happen to look at that regularly just to see what's up, within the healthcare landscape. And I came across this article yesterday, published by the Associated Press. And the title of the article is, Health Officials Let COVID-Infected Staff Stay on the Job. And basically what drew my attention was, first of all, that's something that, just a few months ago was unheard of, right? If you had COVID, you shouldn't even be out there working, period. But again, essentially they're saying that hospitals are swamped with cases and severely shorthanded because so many employees are out with COVID. And rightfully so, they should be. But, and I quote, it also says here, health authorities around the country, around the United States, are increasingly taking the extraordinary step of allowing nurses and other workers infected with the coronavirus to stay on the job if they have mild symptoms or none at all. Swallow that pill. And it further goes on to say, in the Phoenix area, now pay close attention to this, Dignity Health, a major hospital operator, sent a memo to staff members saying those infected with the virus who feel well enough to work, may request clearance from their managers to go back to caring for patients. And I just quoted that from the article. I didn't make that up. So basically now, these changes to their recommendations for healthcare workers with COVID is basically based on staffing issues. Now, did anyone think that, before I make my comment on that, in the next paragraph and in quotes, it also says, and this is a statement from Dignity Health, we are doing everything we can to ensure our employees can safely return to work while protecting our patients and staff from the transmissibility of COVID-19, Dignity Health said in a statement, period. So I don't understand how that correlates to if you're infected with the virus but feel well enough to work, you may request clearance from your manager to go back to caring for patients. Now, I've been a manager in the past, and I would give no such clearance, but that's me. I'm not really sure what people are doing out there these days, right? It looks like, anything goes just to make sure there's adequate staffing. But how does sick staff, okay, and let me repeat this, how does sick staff reduce transmissibility transmissibility of COVID-19 and protect patients. Because as we all know, just wearing a mask doesn't prevent you from getting COVID, particularly with this Omicron variant, which is, as they've said, highly transmissible, right? So, I don't know. It looks like we all just have to figure it out for ourselves and do what's best, right? So, I mean, I know what I would do if I felt sick. I can't tell you what to do. You know what you have to do. You have to make these decisions for yourself. But once again, okay, giving yourself priority, giving yourself importance, giving yourself permission to be well and to be at an optimal state of health and well-being before you go out to expend your energy in the care of someone else who, in all likelihood, is in a far more vulnerable condition. Okay? So let's just pause, put our thinking caps on, and really contemplate whether or not this makes any sense. Just saying. Something to think about. Until next time, this is Tonya, Nurses Speak. Like, subscribe, and share. We'll be talking to you again soon, and we have a guest back to talk to you next time about healthy eating. It's a new year. We want to get started right. Until next time, bye.